Now, this Sunday is the last day of lockdown for now. Tomorrow is our much heralded Freedom Day, when legal COVID restrictions in England are lifted. But new infections are surging. The pingdemic is blighting business and transport. And now the Health Secretary, Sajid Javid, is self-isolating, having tested positive for COVID-19, despite being double jabbed. Well, here's what the Health Secretary had to say yesterday.
Hi everyone. I just wanted to update you all that I've tested positive for COVID. I was feeling a bit groggy last night, so I took a lateral flow test this morning and it's come out positive. So I'm now self-isolating at home with my family until I get the results of a PCR test. I'm grateful that I've had 2 jabs of the vaccine, and so far my symptoms are very mild. And I also want to take this opportunity to thank everyone that's been involved in our national vaccine rollout programme, truly the best of its kind anywhere in the world. If you haven't had your jabs yet, please get out there and get them as soon as you can. And if, like me, you might feel a bit groggy, or you think you might have come into contact with someone who's positive, please also take a lateral flow test too. If everyone plays their part, you're not only protecting yourself and your loved ones, but you're also safeguarding the NHS and helping to preserve our way of life. Thank you.
Well, since then, Sajid Javid's PCR test has indeed been positive. That's potentially bad news for the Prime Minister, who sat down with the Health Secretary for what's called a lengthy meeting at Number 10 on Friday. As of yet, Number 10 has been silent on whether or not Boris will now have to self-isolate himself. We'll keep you posted on this, but it's hardly the best timing, given so-called Freedom Day is tomorrow.
Now, thankfully, Javid's symptoms are currently mild. This isn't a repeat of when the Prime Minister contracted the disease last year. And the really positive news is that every adult has now been offered the vaccine in the UK. That's at least a first dose. And the take-up's actually been high. 88% of adults in the UK have had 1 dose. 68% have had both. Tom, I think you've had 2, and I'm anxiously waiting for my next one.
Yeah, I jumped the gun. I waited for hours to get mine. But what about those who are under 18? Well, the Daily Telegraph says that only vulnerable only 12s will be offered the option of having one, or those living with an at-risk person. 17-year-olds within 3 months of their 18th birthday are also expected to be included, but this is all yet to be confirmed, and an announcement from the government is expected tomorrow.
Of course, we'll bring you that and all the latest news when we get that. Well, it's just as well the vaccine programme is a success, because COVID cases are surging. We're looking at now the last 2 days over 50,000 new confirmed positive infections a day. That is the 3rd highest number in the world, behind only Indonesia and Brazil. Thanks, though, to the vaccine, hospital numbers are still low.
Although the so-called pingdemic is worsening, last week over 530,000 test and trace alerts were sent. That's up by an enormous 46% in just 1 week. Business and transport are already being hit. Parts of the London Underground were shut yesterday, and the lack of staff at hospitality is worsening. The boss of Marks and Spencer's is warning of a massive disruption in food supplies.
Tomorrow has been dubbed, hasn't it, Freedom Day. Scotland moves to level 0. Restrictions will be lifted in England. And what does that look like? So I'm sure you know this already, but social distancing rules will end. That 1 metre plus, that's sort of no longer relevant. As is advised to work from home. And the baton really is handed over to us, the general public. We're being asked to use our own judgment, personal responsibility, as Boris Johnson said. Limits on numbers of events will be gone. Nightclubs can reopen. I think many are opening tonight at midnight, actually, to really get things going. And you can invite as many as you want to parties, weddings and funerals. With daily numbers of new infections, though, currently comparable to what we saw in January of this year, cases are high and experts are really urging caution. Well, this is what the NHS GP, Dr. David Lloyd, has to say.
So the tried and tested methods, I'm afraid, are still needed. We need to wear masks, we need to socially distance, and we need to be jolly careful when we're meeting people we don't know. If you take Wembley, for instance, last weekend, if going on the rate that we've got at the moment, getting on for 250, 300 people would have been at that stadium, wouldn't have known they've got COVID and would have spread it around. So we're going to see a Wembley effect coming through in the next week or two as well.
Well, Dr. Lloyd also told GBNews he was worried about the 1 in 10 who've had coronavirus and then develop long COVID.
Very few people die nowadays, but even young, fit people we're still admitting to hospital. They need 3 or 4 days of oxygen. And then, of course, there are the other two factors, which I think are terribly important. If you go on some data, 10% of people that get COVID, even the mildest COVID, 10% of people will go on and have prolonged or long COVID. And then every person that is infected with the virus has got the potential to spread a mutated form.
Well, the government's last-minute decision to force fully jabbed travellers returning to England and Wales from France from Monday to still have to quarantine has thrown yet another spanner in the works for the travel industry. The founder of travel consultancy, the PC agency, Paul Charles, says that we have to find a better solution to opening up.
We'll bring you more on that a little later, and we talked about it yesterday. I think there was this aghast nature from the travel industry who said, look, you've given us this traffic light system, red, amber and green, so that people can better plan their holidays. And now we have this other category, effectively. Amber Plus, we could call it. You can travel, but then you'll have to quarantine when you get back. It's, in some people were saying it's been absolute chaos. What we're asking you this morning, though, is if tomorrow will feel like freedom. I just want to show you the front page of the Daily Mirror here. They've gone for Freedom Day. Is that fair, Tom?
I don't know. I think that there's actually a bit of consensus among scientists that isn't being reflected in a lot of the press, because, of course, it's not only the Prime Minister that's saying that we should open up tomorrow. It's also Chris Whitty. It's also Patrick Vallance. Even Professor Lockdown himself, Neil Ferguson, said that if we're going to open up at all, potentially this height of summer is the best time to do it, because whenever we open up, we're going to get a rise in cases. It's expected we're going to get a rise in cases. It's expected we'll have a bit of an exit wave to this pandemic. And is it better to have that huge rise in cases now in the summer when it's warm, when the NHS is under less pressure, or is it better to have that way later in the winter? That could cause more deaths. So, there are loads of bad options here, and I think it's about picking the least bad, worst option.
We've been waiting, haven't we, for a taste of normality and freedom, and anxiously waiting for it. Do you think tomorrow in England, and Scotland goes as well, changes level as well tomorrow, so it's a big change for them as well. Do you think it is going to be the Freedom Day that the Prime Minister sort of envisioned, that the public were waiting for, or is it a sort of dampened, watered-down version?
Well, I think for a lot of people it will feel like a huge liberation. Lots of people are going to go to nightclubs tonight. Lots of people will do things. I am intending to. It depends how early they want me tomorrow morning on this channel, but we'll see.
Because I know that when we had the initial date of Freedom Day, when was that, the 19th?
Yeah.
You had tickets to go.
I had booked tickets and they got refunded rather than
that's
delayed.
Great.
So, that was all fine, but I haven't booked tickets now, but I might turn up to one.
Well, you may not need to book a ticket now. Isn't that the whole point? That you can just stand in a queue and arrive? I don't know.
I suppose the question is how many people will be in that queue? How popular will it be? I have a feeling that in central London, those queues are going to be absolutely enormous tonight. But
and some very sore heads tomorrow morning.
No doubt. But that's, of course, for the people who are lucky enough not to be pinged. Because just about 500,000 people were pinged last week. The Prime Minister, who has been sort of chivying along this idea of Freedom Day, may well himself experience a lot less freedom tomorrow than just about everyone else. So
yes, there will be an irony
two halves here.
if Boris Johnson has to herald in the start of Freedom Day from self-isolation himself. One real challenge I think these businesses are going to have, and reporting over the last couple of weeks I've been into sort of hippodromes, theatres, is that if you invite everybody in, if you say in you're a pub or you're a restaurant and you say, right, that's it, get rid of the screens, let's just cram these tables full and get those tills ringing again, if you then get outbreaks of coronavirus amongst your business, it's not just about being pinged by the app. There's going to be more cases. You may then end up in a situation where you can't open and you can't run because there have been too many positive cases in amongst your business. So how do you deal with that tension? All these businesses they've been told by the Prime Minister, we're handing personal responsibility over to you, that's going to be a real challenge. I think we're going to see many nightclubs open to great fanfare and then have to close again because there's been outbreaks amongst their staff.
Quite potentially, and of course the government has been asking nightclubs to use this COVID certification system, the NHS COVID app that allows you to show your vaccine status, but also whether or not you've tested negative on a lateral flow or tested positive in the last 6 months on a PCR test. Now, this COVID certification system was supposed to help many businesses open up safely without social distancing and without masks, but very few seem to have taken it on, and the Nighttime Industries Association has actually been saying that people shouldn't use the NHS COVID certification app, which I think is a bit of a blow to the government, because they were hoping that these businesses would take on that responsibility, but not many seem to, because it might put off those last-minute customers who just want to pop in to venues.
It's also one big question that they've been debating is that if you've had 2 jabs from the vaccine, would you then be exempt from self-isolation if you got pinged by track and trace? But look, Sajid Javid has had 2 jabs and now he's got coronavirus. That's going to complicate the issue even further when the health minister is in that category of people who've got 2 jabs but get the infection.
But the point I think about Freedom Day is that while you have all this pinging going on, the pingdemic, and I think I saw one estimate that we could have 10 million people pinged over the next month, that really sort of feels like half lockdown. It's supposed to be the 16th of August that double-jabbed people can escape that self-isolation requirement. So is that potentially our real Freedom Day?
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.